Okay.
Hello, my name is Martin Lipscomb, and in this conversation I'm joined by acclaimed philosopher Trevor Hussey. Emeritus Professor at Buckinghamshire New University, Trevor is author of the book The Trouble with Higher Education. However, he's at least as well known for his papers on science, logic, mathematics and value theory. Now actively retired, Trevor remains busy, and hence thank you for making time to be interviewed today. Trevor, I'd like to discuss your 2011 paper, Naturalistic Nursing. This appeared in volume 12, issue 1 of Nursing Philosophy. And in the paper, you do several things. You begin by noting that nursing students enter education with developed dispositions, attitudes, skills, motivations, values, knowledge, and beliefs. You then propose that nurse education builds upon these dispositions, etc., by presenting students with forms of practical skills and theoretical knowledge. You note that this building occurs within intellectual frameworks, that these frameworks differ, sometimes quite markedly, and you proceed to argue that amidst the variety of frameworks on offer, what you term a naturalistic intellectual framework is to be preferred since, to quote, it has advantages over others. Trevor, what is naturalistic nursing and what advantages does this approach or framework have over its rivals?
Well, I have to explain that I'm not a nurse, of course. I taught philosophy and psychology in a university. I was invited to contribute to that degree. And when I came to read the nursing theory that nurses were being given, I was struck by the very, very high percentage of it, which was based on a kind of acceptance of postmodern relativism. You know, there are no truths, so it's just a series of stories. Science is just telling one story amongst many, and so on. Now, that seemed to me to be pretty dangerous. I was very impressed by Aaron Sokal's use of a spoof article, which he got published in a very prestigious journal, which they took to be sensible, and it was complete nonsense. And I thought, well, suppose this happened in nursing. If you went along to a doctor and said, look, I think I've got COVID-19, it's I've got sore throat, a terrible headache, and can't smell and can't taste and so on. He said, well, yes, that's one truth, but of course it could be just dandruff or you twisted your ankle. I mean, it just nonsense. So I thought, well, there is a danger in this kind of relativism and belief in force fields and so. So I thought, why not have a nursing based on naturalistic view of the world? So let me say what I mean by naturalism. It's a rather naive philosophical theory with two parts. There's a metaphysical claim and an epistemological claim. The metaphysical claim is about what exists, and the epistemological claim is about what you can know about what exists. Now, the metaphysics says what exists is the natural world. There is no supernatural world. There's just the natural world, and that consists of things like tables, chairs, people, and oak trees. And the epistemological claim says the way we learn about that is through our senses and our intellect, and they are best organized into the form that they take in science. That science works. Now, of course, there are lots of philosophical problems with those claims, as any philosopher will know, but you can at least say that science is effective. We can now fly to the moon and cure diseases and all the rest of it largely through the work of scientists. So there must be something right about it. Now, the idea is that we build that naturalism into a nursing theory. So what would nurses take? Well, of course, they start, as I think you mentioned in your introduction, they start from birth. I mean, they grow up in a family, grow up in a community, and they learn the capacities and the emotions and so on of human beings from just being a human being. And they will know what empathy is and kindness is and cruelty is by the time they come to nursing. But that needs to be supplemented by a more theoretical, intellectual basis. And I'm suggesting that they take that basis from science, the values and the attitudes that would be characteristic of science. So, for example, there'd be a respect for honesty, for truth, and the distinction between truth and falsity. And there'd be rigor, the idea of rigor, and the avoidance of fancy. Another thing that they might take from science is modesty about their truth claims. Now, this is important because science produces theories, amazing theories about the world, but those theories are constantly being tested. They make predictions, you test the predictions, and if they fail, if they're false, then you either modify or scrap your theory. And the most amazing theories have been scrapped. And no doubt our modern theories will also be scrapped. Relativity theory and quantum physics will be modified, or constantly modified. And great theories like Newton's theory is replaced by relativity theory. It's a process that's common in science, and it's a kind of modesty. You accept that your truth claims are tentative, and you have the modesty to accept that. And that would be the same about your ideas about medicine and nursing. Well, a third thing would be that would make the nurses inquisitive and critical. In other words, they would practice their nursing, but they would be critical about what they were doing. And that would, in the end, lead to change and progress. So it would be an advantage in nursing. Another thing would be that they would realize the need for evidence. They would value truth. And that seems to me to be a way in which they would avoid pseudoscience and things like therapeutic touch and various laying on of hands and various other fancies that some nursing theorists have had. Okay, nurses would have a basic grounding in the sciences from physics, chemistry, biology, sociology, psychology, and so on. Now, there, of course, are lots of problems with this, and in my paper, I do try to discuss some of them. One suggestion, which I think is easily dismissed, is that nurses with a scientific background would be cold and calculating. Now, I mean, just your experience of scientists will tell you that they can be as affectionate and friendly and kindly as anyone else. So I think that's just simply a nonsense. Another criticism might be that they would lack the ability to experience and understand the spiritual side of life. Now, this is more difficult because it depends what you mean by spirituality. And this led me to a discussion of this book by Barbara Barnum, Spirituality in Nursing. Now, I won't go through all the criticisms I make of it, but the fact is she has a very high-flown view of spirituality. Apparently there are levels of spirituality, and at level 6, my goodness, you have connection with the infinite, you have contact with other realities and mystical experiences. Now, for most people, spirituality means the kind of feelings of awe and wonderment you get when you have, say, when you enter a piece of woodland, or when you walk on a hilltop, or when you listen to beautiful music, or read poetry, or see a work of art. You really don't need to be elevated to the level of Mother Teresa and Gandhi to be spiritual. And it would be daunting for patients if that very high-flown view of spirituality was what was presented to them by a nurse. I mean, they would just simply feel inadequate. You need a sensitivity to the normal levels of spirituality. So I don't think a naturalistic nurse would be any disadvantage in concerning that. But another criticism is that the nurse could have a closed mind, particularly in the face of religious faith, because the assumption is that she would not have a religious faith. I don't see why not. I mean, plenty of religious people are scientific, but there you are. But one of the problems here is that's probably a bigger criticism of religious people. I mean, after all, religious people believe that their faith is God-given. They derive it from a holy book, the Quran, or from the Bible, or whatever, and it's a fundamental text guaranteed by Almighty God. Now, no wonder they end up quarreling about it, and you get Muslims killing Christians and Christians killing Muslims. You get it within religions. I mean, Shias versus Sunnis, Sunnis versus Shias, Protestants killing Catholics, Catholics killing Protestants. It's a recipe for intolerance as much as it is for tolerance. So I don't think that naturalistic nurses would be at any disadvantage in that respect. In fact, there is a kind of sensitivity that would come with naturalistic nursing. For example, I've heard of patients who are very religious, who are convinced that it's a punishment by God and that their pain and their suffering is because they've done something wrong. Now, this is not the recipe for quick recovery. Healing is going to take longer, if anything, if someone has that kind of view. Now, a naturalistic nurse, without preaching atheism, could at least put some doubts in the mind of the person who believes that they have a God that would do that to them. I can imagine them being quite as sympathetic as, say, a strongly religious nurse or someone who's completely indifferent to religion. I'd like to read the last paragraph of my paper that you mentioned, because it is significant. I think I say to this can be added that there is a kind of nobility in the naturalistic view of mankind. People are valued for what they are, amazingly complicated, diverse individuals with hopes, fears, and the capacity to feel so many emotions and invest the world with meanings and values. Such lilies do not need gilding with immortal souls, supernatural fathers, or transcendental energies. They're sufficient in themselves. So it's quite a reasonable view of mankind, as it were, of humankind. Now, in the paper, I tried to deal with a number of objections, and I've gone through several of them, but one of the problems is that in a nursing theory, you've usually got some kind of moral thesis at the center of it, a set of values and ethics. And it's very difficult to know quite what would fit naturalistic nursing, and it's a real problem. One suggestion is that it would be moral realism. Now, I don't know whether you'd like me to say something about moral realism.
In the paper, you introduce moral realism and then you step away from it. Perhaps it would be useful to have a couple of sentences, a little bit on realism.
Yes. Well, moral realism is a theory of morals that comes from this central problem in moral philosophy, and that's the distinction between is and ought, between facts and values. And where on earth do we get our values from? You can describe a person or an action, but how do you get to the conclusion that it's morally right or morally wrong? And of course, people will suggest, well, we get our morality from God. You don't get it from the facts at all, you get it from God. Others will say, no, you just grow up in society and you adopt the morals of your culture. But clearly, even living in a strongly moral community, people can question it. So in the end, people might say, well, it's a subjective judgment. Well, moral realism tries to overcome the problems with all of those, which is mainly a relativist view. Moral realism says, no, moral judgments are either true or false. If someone says that torturing an innocent individual is morally justified if it gets the right result. So you stop a war or stop lots of killing, you're morally justified to torture an innocent person. And if somebody else says, no, torturing an innocent person is always morally wrong, then one of those is right and one of them is wrong. That's true. One is true, one is false. The trouble is deciding which is which. But I'd like to accept some kind of moral realism, but what moral realism claims is that there are moral properties that acts and people and situations have, and that we're capable of detecting those moral properties. So you detect that something is morally good or morally wrong. Now, this is very dubious stuff, and that's why I'm not entirely confident about moral realism. But there are ways in which you might look at moral realism that makes it more persuasive. For example, suppose there was a species exactly like us, except we didn't feel pain, we didn't feel pleasure, we didn't feel happiness or sadness, we were never afraid, have no emotions of that kind. You can see that we wouldn't have a morality like the one we've got if we had any morality at all. So there must be some connection between our values, our moral system, and the facts about human beings and what they can experience. And you can go even further than that. And you can say, well, if you look at the language we use to state those facts about human beings, like he is afraid, built into that is a moral view, because to be afraid must mean that you're contemplating or experiencing something which is noxious, is something which is negative and nasty. Same with pleasure, you experience something which you consider to be good. So if you look at these so-called facts about human beings, they have their values built into them in some way. So it might be possible to save moral realism and end up with a theory which was applicable to nursing. That's I didn't pursue that in the paper, but that's what I think I could try and do.
Okay. The paper is quite a short paper and it contains a very large number of ideas. I'd like to ask you just a couple of questions about the paper, but I recognise that in doing that, I'm only picking up on a small fragment of the number of things that could be picked up and discussed. Would you say anything about evidentialism? Are you suggesting, for example, when you're promoting a version of naturalistic nursing, that we should only believe those things that there is evidence for? Brian McGee was quite critical of that idea. Is that what you're suggesting, or am I putting those words into your mouth?
I accept that it's not easy to avoid evidentialism, and there are problems with evidence. There are lots of philosophical problems with evidence that I really don't know how to answer. But I don't think I'm saying going as far as that. I'm just simply saying that if you are going to make changes, then you need reasons for doing so, and the reasons for doing so would be what I would call evidence, and that they would come from a scientific examination of what you're thinking of changing. If that's evidence is, then I accept it, but I don't think it is. That's not a very satisfactory answer, is it?
It's a tricky answer. Let me ask a follow-on question then. I think this does follow on. Naturalistic nursing makes sense when the sorts of things we're interested in lend themselves to or can be framed as propositional statements. What then should nurses make of those aspects of life, of practice, of action that defy that framing?
I don't think that they would have to, first of all, claim that everything can be expressed in propositions, although a lot of practice can be, it can be described. and you can use those propositions to think about the actions. But a lot of what they would learn would be practice, and they would be as critical about the practice and its consequences, whether they put that into a series of propositions or not. I don't think that there's any reason why they couldn't be critical and evaluative about their practice. I'm not sure whether that's answered your question, but do you see, I don't see any fundamental problem.
Okay. I suppose I was thinking of those aspects of what we do which refuse to be put into the types of propositional statement that science lends itself so well to investigating and commenting on. But let me move on from that. When I read your paper, I read it from the perspective of someone who introduces nurses to evidence-based practice and teaches about methods and methodology. That was, when I was reading your paper, I was coming in from that angle. And the thing that jumped out at me from your paper is that we do in fact promote, as nurse educators, a worldview, a frame that suggests that indeed we ought to look at the things that interest us through the lens of science. And although we will mix research results, research findings with patient experience and our own expertise, nonetheless we are presenting to students a worldview, but we don't make that explicit. Now that's a comment rather than a question, because I appreciate you're not a nurse, but that's one of the reasons I thought your paper was particularly interesting. Whilst it is a comment, is there anything you'd like to say about that?
Well, only that I'm not recommending that the nurse comes in on the first day and says, I'm a naturalistic nurse and this is what I believe. They would just do the nurse education in the way that anyone else would, but behind their thinking and their teaching would be naturalistic nursing. But they're not going to preach naturalism to anybody any more than I think, say, a Catholic nurse would teach Catholicism to their nurses before they start on the nursing. I don't think they would. I don't think I'm in any different position than anyone else.
Okay. You do say in the paper, or you suggest that a nurse who has religious beliefs, I think you used the example of a Catholic nurse, would perhaps leave those aspects of her belief, supernatural belief, at home, come into work and take up a naturalistic frame, go home again and adopt a way of looking at the world that allowed in the supernatural. Is that actually feasible at all?
I think it is. I mean, suppose you're a sort of mildly Christian or Muslim. You may pray when you go to bed at night and so on, but in your teaching you could take a scientific basis for things. I don't see that you're forbidden to do that. I mean, I suppose if you were a fundamentalist and you really did believe in say the Bible story of Adam and Eve was absolutely true, I think you might have difficulty, but apart from that, I don't think it would be a problem.
Trevor, let's wrap it up there. Your paper is short and contains many ideas that implicitly, I think, have a great deal to say to people interested in the way that research is taken up and used, and certainly in relation to evidence-based practice. I heartily recommend it to anybody. Thank you for joining me today.
Thank you, and I hope the least it does is make people argue.
I'm sure anyone who reads it, I'm sure will argue. Thank you very much, Trevor.
Thank you.